Hi everyone, Dr. Andrew here again with another short video presentation in a series called New Health for the New Normal. And it's also part of my upcoming book with the same title. In my previous video, I talked about new studies on long-term immunity to COVID-19 and how it's been shown that the antibodies in previously infected patients don't last very long. In this related video, I want to talk about the dangers of rushing a vaccine for coronaviruses. I titled this chapter in my book, The Vaccine Conundrum, To Rush or Not to Rush. As the coronavirus pandemic drags on, it takes its toll not just on our physical health and finances, but on other aspects of our lives as well, including our mental, emotional, and psychological well being. The whole world is becoming more desperate for the promise of a long awaited miracle cure, in quotations, that would finally put an end to COVID 19. And of course, this is expected to be in the form of a vaccine. As much as I'd like to go back to the way things were pre COVID, rushing to come out with a vaccine is not a very good idea, and here's why. Operation Warp Speed is the name of the vaccine development initiative in the US. And this is one example of a program that raises concerns from some experts. And one of them is a bioethicist named Arthur Caplan, who said, "For scientists and physicians, the term warp speed should trigger concern. Good science requires rigor, discipline, and deliberate caution. History tells us that speed kills." And that's a very important thing to keep in mind. Another expert, Dr. Peter Hotez, who's the Dean of National School of Tropical Medicine at Baylor College of Medicine, and he's also been vocal about his concern for rushing vaccines. He was one of those who worked on the development of a vaccine for the very first SARS outbreak back in 2003, and that's officially called SARS-CoV. And according to him, coronavirus vaccines, in particular, carry the risk of vaccine-induced enhancement, where instead of protecting against the infection, the vaccine can actually make the disease worse when a vaccinated person is infected with the virus. And until now, scientists and experts don't really understand the mechanism of why this happens. And that's why it's been a stumbling block for them to develop vaccines, particularly for coronaviruses. So it has something to do with the nature of coronaviruses. While he was working on a vaccine for SARS, Dr. Hotas found that some vaccinated animals developed more severe disease compared with the unvaccinated animals when exposed to the virus. So the way you reduce that risk, according to him, is first to show it doesn't occur in laboratory animals. Normally, vaccine researchers would take several months to test for the possibility of vaccine-induced enhancement in animals. However, because of increasing pressure for a COVID-19 vaccine from world governments, some drug makers are moving straight into small-scale human tests, and that's alarming. And that's without waiting for the completion of the necessary animal tests. Dr. Hotez testified before the US Congress, I think that was back in March, late March, and he pointed out a very disturbing fact about coronavirus vaccines, and that is there are no existing vaccines for any of the new coronaviruses that have caused outbreaks in the last 20 years. And that includes the first SARS, and also MERS, MERS, which is the Middle Eastern Respiratory Syndrome, I believe, and the current COVID 19 virus, which is the SARS-CoV-2. So there are none that exist today. Move on to this slide. I just wanted to point out that this not only suggests it may take years to develop a safe vaccine for COVID-19 the proper way, but it should also make researchers and manufacturers of vaccines cautious about cutting corners and sidestepping the important animal safety tests before jumping onto human tests, which brings me to this next slide, where only recently there's news of 30,000 adults being enrolled to test an experimental vaccine, which, surprise, surprise, is under the Operation Warp Speed program. And according to them, they aim to accelerate development, manufacturing, and distribution of vaccines and treatments for COVID-19. And I want to bring up the case of the Ebola vaccine, which actually just came out very recently in late 2019. But the height of the outbreak was in 2014, and that's where I began researching on the Ebola outbreak, which almost became a pandemic, but thankfully it didn't, because that actually is more deadly with a 50% mortality rate. But anyway, Johnson and Johnson, and yes, that is also a company that produces drugs and vaccines, rolled out with their experimental vaccine 5 years later in late 2019. So that's how long it took them to come out with an experimental vaccine. And considering that they weren't really under pressure because this wasn't a pandemic, they tested that experimental vaccine, on the people of the Democratic Republic of Congo. And if you were wondering how effective that was, simply Google Ebola outbreak Congo 2020, and you'll find that it hasn't really done anything to stop or control the outbreak. And numbers of deaths have continued to rise on a daily basis. And just a reminder, the flu has a vaccine and it still kills thousands of people each year. Thousands of people each year. And they keep telling us to get a flu shot every year because new strains are always coming out. Is this going to be an omen of similar things to come with coronavirus vaccines? Well, hopefully not. And assuming that they do come out with an experimental coronavirus a virus vaccine that proves to be safe enough not to induce immune enhancement in some people, the next question would be, is it even effective in giving us long-term immunity to COVID-19? And I think that's the more important question. And I came up with a previous video about new studies suggesting long-term immunity to COVID-19 through antibodies may not be relied on. And I will post a link to that video over here. I encourage you to watch that, and it's very important. It could be a game changer in terms of what they're finding out about long-term immunity. But the problem is that most, if not all, vaccines being developed today work on the principle of inducing antibody production from B lymphocytes, also known as B cells. So we have a problem here. Those studies that I talked about in my previous video show that T cell immunity has been shown to be more accurate in determining long-term immunity. Now, it's important to note that the studies about T cell immunity have only been published months after all the drug makers of these vaccines that are supposed to come out first began announcing the development of their vaccines. So, what's the problem? Were these drug makers aware of the problems with antibody versus T cell immunity, and have they considered these factors in their vaccine development before they spent the millions of dollars in their research and development? So that's an important question to ask. Or are they already aware of this, and yet they may still push for the sales of vaccines in order to recoup their investment? So, in other words, Are they aware that antibodies don't really last very long in the bloodstream, as pointed out in several different studies? And are they still going to push their vaccines, which is based on antibody production? So, hopefully not. Let's always keep in mind that every single pharmaceutical company's primary legal obligation is not to the public's health and wellness, but to their shareholders' pockets. They have an obligation to increase profits, and they've made this public. It's not a secret. So I'm not saying that all coronavirus vaccines are evil, if any of them do exist. What I'm saying is that drug makers shouldn't be cutting corners and sidestepping important animal safety experiments just to roll out these vaccines at warp speed. It's very important to slow down and do things properly. So that's it. I just wanted to point these things out. It's something very important to keep in mind, especially since the experimental vaccines are scheduled to be rolled out very soon, maybe if not next month, by November. And we should be aware of the possible risks of rushing the development of these vaccines, as well as the question of whether or not they are going to be effective. So, thank you very much for taking time to watch this video. I will continue to come up with videos for this series. So, until next time, stay healthy and sick free. This is Dr. Andrew. I'll see you again.